One of the biggest extra benefits, and sort of for obvious reasons, is dental. That is available on many of the Medicare Advantage plans. And yes, it's a benefit that is relatively easy to understand because it helps with your dental costs, right? But today, we're going to do a survey of how exactly the dental coverage works and what you could expect from your Medicare Health Plans dental here in Southern California, available in 2025. Hi, I'm Michael, and this is Michael's Medicare. Any of you or somebody you know has questions about their Medicare options, please feel free to reach out to us at the information down below. And either me or somebody from my team will be happy to help them at one of our many offices across Southern California in English or Espanol. Also, don't forget to like and subscribe. So dental is important, and taking care of one's teeth, especially as one grows older, is important because of the simple fact that teeth seem to start to crumble at a certain age. But dental coverage is one of those insurance coverages that comes in many shapes and sizes, and also because it was never reformed like health insurance under the Affordable Care Act or even included in original Medicare. So it can be sort of the wild, wild west when it comes to benefits, standardizations, and networks. So let's take a look at a couple examples of the dentals that are available to Medicare beneficiaries through their Medicare Advantage plans here in Southern California. So first up, let's take a look at a Medicare plan that is available in San Diego. Specifically, it is open to everybody. It's not a special needs plan, and it's not a Medi plan. It's a everybody plan, which is the Scan Alta plan. Now, despite having a really quite good benefit structure for their health care, it's actually a very noticeable dental coverage as well. That is comprehensive, and it comes automatically with the plan. Here we can see that the dental CAC 73, that is the number for it, is going to be included. It has no additional monthly premium, and it is going to be an HMO plan. When we look at the cost for things like oral exams, dental x-rays, and prophylaxis, that is cleanings, like real cleanings, not just the once-a-year cleanings, those are going to be at a $0 copay, assuming someone goes to the dentist that is within the HMO network. For further services, for more extensive services that is, they are still going to be covered, but will have a copay that's going to range depending on how much and how many of the services that are being utilized. For this one, we can see that for fillings and crowns or restorative services, there are copays that can range from as low as $8 up to $395, but it is a set copay and not just a percentage of the total cost. So that's nice that you have a set cost. Furthermore, we should notice that the HMO version of this plan, there is no limit or maximum cost. But also remember that HMO means that there is no out-of-network dentists that are going to be utilizable, so you can only see those dentists who are in the network. Now, to keep things simple, let's talk about a PPO version of the exact same dental plan available through Scan on the Scan Alta plan, because the dental can be either HMO or PPO. The HMO is the default standard plan available on the plan automatically, but the PPO can be opted into and has pretty substantial additional monthly costs, but has one really, really big benefit that a lot of people and a lot of dentists really like. First of all, we can see that there is a monthly premium that would be part of getting the PPO version of the Scan Dental at $55 a month. So that is just an add-on. It has to be paid whether or not somebody uses those benefits. It's just a monthly premium, whether they use those benefits or not. And yearly, that comes out to around $660. So, that's not nothing. When we look at a comparison of benefits, at least for diagnostic, preventative, and even comprehensive benefits, it's all going to be the same. But where the difference really shows, aside from the premium, is going to be on the overall coverage. Because although there is no maximum in-network cost, there's going to be an out-of-network maximum of $2,000. So important to note, this is not the limit that a beneficiary can pay. So it's not a cap on the cost of the beneficiaries like you would have with a maximum out-of-pocket or MOOP, but rather is the limit that's Scan, the insurance company or the dental insurance, will pay on behalf of the client. So once that $2,000 is spent, is reached, that's all they get for the year on the PPO. So there are some substantial costs and sort of substantial downsides to getting a PPO plan, but what is the main guiding benefit that is the reason that people get and love the PPO? Well, it is that dentists, almost all dentists for that matter, who are in demand, who are loved by their patients and who do a really good job, well, they usually are in a position to only accept the PPO and the higher payments that come along with it, and will only very sparsely usually take the HMO versions of these plans. The reason, again, money. But if you find a good dentist, and they can be really hard to find, and you want to keep them and you want to get help paying for one or two of those teeth that have been needing some work with that dentist, well, the PPO oftentimes is really going to be the only option that you have with those higher costs. And with Scan, the Ulta, it is an option that you can have. Another great plan we often recommend to our clients, at least for those who are in San Diego, and yes, I know we'll get to Los Angeles plans here in 1 second, but another one that I wanted to review is the Dental Under the Sharp VIP Medicare Advantage plans. And for folks in San Diego, they will know that Sharp Hospital Network, because it is one of the biggest in the country, is really valuable. And that being said, their VIP plan that is specifically from the Sharp Network comes with a comprehensive dental with a PPO option as well, where their dental is run through one of the largest dental health plans, maybe in the history of dental, Delta Dental. When we look at the benefits, because they will be the same on the HMO and the PPO, we can see the office visits for dentals are set at a $5 copay. And x-rays that your dentist always hits you up for so they can stay current. Yeah, right, sure. But those are included as well at a $0 copay. For fillings, it's a $55 copay. And there's even coverage for things like dentures, which is not always covered, but dentures in this case are still pretty expensive at $395 up to $495. But again, that is still way, way better in comparison to what you would have to pay for dentures if you're just paying out of pocket, or if you're just paying cash, or if you didn't have coverage. Lastly, moving to the PPO version of the dental, which it will allow for more access to many, many, many more dentists. That comes at a monthly premium of $40 a month. So there is an extra premium, but the HMO plan, that one is automatically included and has no additional monthly cost. All right, so that's enough of the San Diego talk. Let's talk about Los Angeles and take a look at a very popular plan from one of the biggest carriers, maybe again, one of the biggest carriers in the world, who also has included dental on their Medicare Advantage plans, which is going to be the Blue Shield Advantage Optimum Plan HMO. Now this HMO dental is going to be full coverage and it doesn't have a monthly premium. Furthermore, it has coverage that will include Medicare covered dental services, which basically just pay for, someone to shine a light on your teeth and look at them, but also included are non-Medicare covered dental services. Things like cleanings once every 6 months, which is pretty good. That's twice a year, and that's still considerably better than a lot of plans that are either 12 or even once every 24 months. Additionally, if we want to look at more specific benefits for metallic inlays, it's a $300 copay for one service or two services as well, with no frequency limitations. But for things like periodontal scaling and root planing, I don't know what that is. That doesn't sound enjoyable, but for 4 quadrants, that is also going to be covered as well. But oftentimes, despite how much unpleasurableness these procedures are, it is much better than the alternative of just letting your teeth fall out. So yeah, brush your teeth, lesson from a pro. Either way, the point being is that the Blue Shield Advantage Optimum in Los Angeles included dental coverage that is comprehensive. It is a nice addition to the full doctors and normal hospital networks that come with the dental plans on their Blue Shield HMO Medicare Advantage plan. Last of the day, let's finish strong with another Medicare plan from Los Angeles. And it's not super well known like a Blue Shield, but it is still very good and has some complementary benefits to go along with their dental that makes them very enticing to our clients. This plan specifically is the Alignment Smart Saving HMO. Now this plan is for everyone. It's not a special needs plan, and automatically included is dental services, at least basic dental services to say the least. It really is just primarily some very basic cleanings and x-rays and fluoride treatments, and that's all good and okay, especially if that's the only thing you need. For full comprehensive coverage though, there actually is one of the higher monthly premiums on it, which is at $64.90 a month. And the benefits, they're okay. Not amazing, but okay. But there is a relatively low limit of $1,500 for those benefits, meaning that that's the max that the insurance company will pay on behalf of the clients. But with all that being said, why would someone think this would be a good option? Well, there's other benefits on the plan that could make it worth it. Primarily because it's one of the few plans available in Southern California with the highest Medicare Part B giveback or reimbursement at $150 a month. Now what this does is pay a portion of the Medicare Part B premium of $185 in 2025. The Part B giveback will pay the first $150 of that on the beneficiary's behalf, basically saving Medicare enrollees $1,800 a year in their Medicare Part B premium. So with that light spread down upon it, paying the extra $64 for dental looks sort of a whole lot better, because when all the numbers figure out, there's still maybe some savings left in one's pocket even after getting dental benefits. Just one complicated aspect of consideration for which plan to do dental on, but I wanted to mention it. All right, so there you have it. This is one of the ways to look at Medicare dental plans and benefits that are available in 2025 in Southern California, because there are HMO plans that come standard. There are PPO versions that have a bit more cost to them, but can also be a good option if you love and want to keep your dentist. And there are other more complicated calculations when it comes to weighing out which plans have the best benefits and make the most sense for you, especially when that Medicare Part B portion is thrown into the decision-making matrix. So either way, Medicare plans can be a bit messy to try to figure out on one's own. So if you or somebody you know is trying to figure out which Medicare dental benefit works for them, or really any other question about their Medicare health plans, please feel free to reach out to us at the information down below, and either me or somebody from my team will be happy to assist them at one of our many offices across Southern California in English or Espanol. Also, don't forget to like and subscribe. So for Michael's Medicare, of course, I am Michael, hoping that you have a great rest of your day, and goodbye.